Good morning, everyone. I think people are joining us. We're going live. Good morning. I'm Oshkosh. I'm John Casper with the Oshkosh Chamber. Thank you for joining us again for this monthly installment of our HR briefings. We used to have breakfast involved with these, but not so much these days. Hopefully, soon we'll come back to that. Today's topic certainly is fitting for the time. Just remind everybody that we are recording this. We'll have these online if you want to go back to it. And if you want to ask questions, please use the Q&A button on the bottom of your screen. And I think John and Jim usually monitor those as we go along and answer those questions as they come up when they can. But today's topic is dealing with a positive COVID test in the workplace. Something we hadn't had to deal with here ever. So I'm hoping we don't have to deal with that, but it's certainly something everyone has to be conscious of. So with that, I'm going to throw it over to Jim Macy with Von Briesen and Roper, and he will take the program from here. All yours, Jim.
Good morning, and thanks, John. Appreciate that. With me today is one of our shareholder partners, John Iden, and it's a pleasure for us to be here again. As the chamber has asked us, and for those of you that don't know, we're going to be doing breakfast briefings or coffee briefings over the next period of time here on the third Thursday of the month. Let me just add that if people have specific topics they'd like us to address for them, to just email them to John Iden or I, and we'll put some things together. And quite frankly, this program today came together based on some input from a number of you that had said, boy, we could still use an update on this stuff as it just continues to keep evolving. We think back at the time that they said, well, we're going to have to deal with this for a couple of weeks. So everybody grab onto the arms of your chairs for a couple of weeks here and we'll get through this. Who would think? And as John and I were brainstorming about putting this program together, and compliments for John for pulling a lot of the data together today. But here we are months and months down the road. And I can tell you, with no hesitation at all, that there isn't a day that doesn't go by that John and I aren't working with some of you on something unique or something different yet again that's come up under this pandemic situation in the employment settings. We will get through it, as we said early on, and you all are, but not without staying up to date on what's the latest, greatest coming out from either the federal government, the state government, or as we're going to talk about today, even the local governments with health orders and different things that impact all of our businesses, including ours, as we've had to quarantine some of our people have tested positive in different offices across the state and deal with those kind of issues. So we're right with you with that as we work through those kind of things. John, I'm going to turn it over to you, but any other intro comments from you before we get rolling here?
Yeah, I think your summary did a nice job of our thought process coming into this presentation. It is an update on guidance, and we've been talking a lot about the guidance over the last 6-7 months, but I think the questions that you and I are getting are starting to evolve in what was 3 months ago, what do we need to do to be prepared and to be compliant? And now, given the amount of time that's passed and the increase in cases, we're getting more questions from people that this is directly impacting them, and they are seeing cases in the workplace, and they have questions about how to respond and keeping people out for the recommended periods of time, and the pressure that puts on other employees and the impact it has on the ability to do business. So where are the legal parameters, or what are the legal consequences with working within and maybe on the fringes of what this guidance is? And that's kind of, again, the thought process coming into today. So just to give an overview, we are going to talk about updates on protocols or guidance regarding masking, testing, and quarantine, focusing specifically on cases or situations where you have an employee who's tested positive for COVID-19, an employee who has reported symptoms consistent with COVID-19, and an employee who has reported close contact with someone who has tested positive. And I think that last category, the close contact, is the hardest for employers to deal with and administer. I mean, you're theoretically on notice of someone being potentially infected, but there's an incubation period and there's an ability to transmit without symptoms. So we're going to talk about what that guidance is and how you kind of work within that guidance in your workplace dealing with those situations. Also going to talk briefly about some COVID-related litigation, what we're seeing now and what we anticipate to see going forward, the types of questions and cases that not only are being discussed, but are starting to be filed, and those are expanding as well. And then finally, looking ahead to 2021, what we kind of expect by way of continued litigation, impact on workforce, and the next iteration of the FFCRA and some sort of leave component. So starting first with a brief history of the executive orders, and I think it was helpful for me at least to just briefly run through the timeline because it sets the stage for, one, the legal challenges that are currently happening in the Wisconsin Supreme Court for the mask mandate, which is currently set to expire on November 21, but has been extended. We're going to talk about that. And it also helps set the stage for what has happened and what has been challenged at the state level and how those state challenges or those challenges at the state level are going to impact what we may be seeing through the end of this year and in the next year by way of local orders. So again, just to briefly go through the history here, we started in March of this year was the first declaration by Governor Evers of a public health emergency. And the significance of the public health emergency declaration is that it increases the authority of the executive branch to basically pass laws, which are otherwise exclusively within the jurisdiction of the legislature. So by declaring the public health emergency and delegating authority to the Department of Health and Human Services and Secretary Palm, the executive branch then has theoretically the power to pass the type of statewide mandates and the safer at home orders that we did see come after that. So after the initial public health emergency declaration on March 12th, we saw the first safer at home order, which ran from March 25th to April 24th. This was the order that closed down non-essential businesses and also closed schools. At the end of April, we weren't seeing any great improvement in cases. There was a concern about sending everyone back to work and school. So at the end of that order, there was an extension through the end of May, basically through the end of the school year. There was a Wisconsin Supreme Court challenge to the extension and the authority of the Department of Health and Human Services to extend the safer at home order. The details of the statutes underlying their authority and the Supreme Court decision is kind of outside the scope of this conversation, but the Supreme Court did overrule the extension to the safer at home order and basically concluded that there wasn't authority to extend it. And as of May 13th, when that decision came down, the safer at home order was expired or extinguished. We didn't really have anything in place at a statewide level outside of the guidance and the recommendations for much of summer leading up to going back to school. You remember there was a lot of discussion end of July, early August about what reopening protocols were going to look like in the various school districts around the state, and we saw a lot of variation, and particularly on the question of masking, whether or not schools were going to require masks if they brought kids back into in-person education. And there was to kind of take that issue out of the school district's hands, there was a statewide mask mandate implemented on August 1st, set to run through September 28th. That was the original mask mandate. Again, that mask mandate was extended on September 22nd and set to run through November 21st. So that's the extension to the original mask mandate. That is the extension is currently being challenged before the Wisconsin Supreme Court. We'll talk a little bit about that case. But up until yesterday, there was really a question of, or a question of what was the significance of the Wisconsin Supreme Court case. They heard oral argument last Monday. It's set to expire November 21st. It's really irrelevant what the Wisconsin Supreme Court decides because this is going to be moot. This is going to be expired. Well, yesterday afternoon, you never print these presentations until 5 o'clock the day before, and even then you might miss something. So yesterday afternoon, we're updating the presentation because Evers has indicated that either today or tomorrow he's going to issue a new executive order extending the mask mandate through January 2021. So now the Wisconsin Supreme Court case that's currently pending becomes incredibly significant. And then finally, the last one to mention is the November 10th executive order, which was just recommendations. It was not a mandate. There were no consequences for noncompliance, but it included recommendations that looked a lot like the Safer at Home order from April and May of earlier this year. No non-essential travel, leave home only if you absolutely have to, remote work when possible. So again, just recommendations, wear masks, just recommendations. But again, we'll talk about the significance of the guidance, and that executive order from November 10th is another piece of guidance and recommendation that was passed in conjunction with the State Department of Health. As we talked about yesterday afternoon, Governor Evers indicates that he plans to extend the mask order through mid-January, and the authority for this extended order will depend on the Supreme Court's decision on the pending appeal. So right now there's a challenge to the extended mask mandate, and the challenger's argument at a very high level is that the authority of the governor to issue a public health emergency is a 60-day period of time. And the statute doesn't allow for the governor to just continuously re-up this public health emergency designation to essentially usurp the legislature and allow the executive order indefinitely, or excuse me, allow the executive branch to indefinitely legislate under this public health designation. The statute allows for a 60-day public health emergency declaration, and the argument is the time limit is in there to avoid exactly what's happening now, which is an extended period of time of legislation at the executive level. This is taking the legislative authority away from the Senate and the House or the Assembly at the state level. The governor's argument is that, well, the emergency order expired, but the public health emergency continues to exist. And I have the authority under the statute to declare a public health emergency when the circumstances are there, and the circumstances are there. There's no cap, or excuse me, there's no language in the statute that says this is a one and done exercise or this is a one and done authority. So that's the issue before the Wisconsin Supreme Court. And if they agree with the challengers that this isn't something that can happen repeatedly and indefinitely, then there's a significant question and maybe a decision that the extension to the mask mandate is that there's no authority to extend the mask mandate indefinitely or to continue extending the mask mandate. So there wouldn't be, depending on the Supreme Court decision, the extension may be invalidated, so there wouldn't be a statewide mandate. So what happens if there's no statewide mandate? If there's no statewide action, if the governor's authority, similar to the Safer at Home extension that was shot down or was overruled in May of this year, if there's no statewide mandate or order, then at the statewide level, we're left with simply guidance and recommendations from the Department of Health. However, there is the authority, and we're likely to see challenges to the extent that this authority is being exercised, but local health departments at the county level arguably have the authority to implement orders similar to what we were seeing at the statewide level. And we're going to talk about Dane County, which is the first, not surprisingly, is the first to pass one of these types of orders, what they have implemented under their county health department authority. So the Republican legislature, which if the executive branch doesn't have the authority to act unilateral of the legislature, then the question goes, well, can the legislature pass something? They obviously have the authority to do that, but the Republican legislature has taken the position to date that they prefer a regional approach to this and allowing kind of, and not even regional in the sense that county health departments pass orders, but regional in the sense that each individual locale, each individual person, each individual business they can have the ability to review the guidance and implement appropriate precautions based on what's happening in their community. That trying to legislate this by the executive branch or even at the statewide legislature, it just is, it's a model that doesn't work because the impact of COVID-19 is varied so much around the state. So it's unlikely that we see statewide legislative action. So again, then we're left with the county orders or the local orders. As it is right now, most county health departments, at least the ones that we're working with or that I'm reviewing their websites, most county health departments are providing guidance and recommendations, and they're pulling from state resources and CDC and federal resources, but the website and the content, again, takes the form of guidance and recommendations rather than orders and mandates that, if not complied with, have consequences and fines attached to them. Now that, again, has changed in Dane County, who earlier this week passed an order that's effective from November 18th to December 16th. The order prohibits any indoor mass gatherings of individuals from outside the household, limits outdoor gatherings to 10 people, prohibits all indoor group exercise classes, requires face coverings. Businesses are limited to 50% capacity, and restaurants are limited to 25% of their indoor capacity. So it's a fairly significant limitation on the ability to gather, and then also significant restrictions on businesses and the hospitality industry. So again, we're seeing, and this is a nice transition to what we're seeing closer to home, but we anticipate to see more discussion of orders like this at the county health department level. And again, this is already happening in Winnebago County. Jim can explain in a little more detail.
Sure, and let's, in terms of what John was just talking about with the three levels of government, the federal government. So on that stage, what are we looking at? We're looking at, are they going to do things that they did on that level before? In terms of the Recovery Act, are we going to see the extension of the leaves? And we'll talk about this a little bit later when we get into it, but at least the federal government's role, will they provide more money to businesses? What are they going to do about unemployment compensation? That's sitting out there for us. So as John talked about then, okay, at the state level, what's going on there? Well, nothing new. Well, something very significant. Let me say this first. Notice that the transition that John had talked about went from the state shutting down our businesses to now fighting about whether we wear masks. Note that the governor's order has changed from an original order that shut down our businesses to one that is recommendations. So the Supreme Court case is going to be very significant because it's got to do with the fight and the authority between the branches of the state government. For what it's worth, it looks like the governor has backed off from the state authority of shutting down businesses and fining us and passing that to the local authority, the local health officers. And that's where most of the action is in terms of those things that directly impact us. What I hear from we hear from a lot of the businesses is, we can roll with the mask stuff, shutting us down or not knowing what's coming in a couple of weeks is the most devastating piece to this. Now we're getting into the more devastating pieces of this as the Dane counties start to do what the governor did early. So what's going on locally for us? There's been a huge debate within Winnebago County over, and just so you know, in order for a local group to do this, the county board has to enact first to do some kind of ordinance to give authority to its local health officer. And that hadn't happened up until just the other night. Winnebago County had not taken the steps that Dane County did earlier, authorizing its local health officer to act, and then the local health officer putting in place these restrictions. Step one has just occurred the other night in Winnebago County after months of debate. Hundreds of people participating in the debate, mostly against the county acting. They acted and passed their ordinance last in fact, just Tuesday night, and a 20-16 vote as far as that goes. Lots of people on the county board here. I sometimes feel, John, you and I are the only two that aren't on the board. But anyway, that aside, a lot of people on the board, 270 people attended this meeting. Most spoke against having any kind of restrictions or this kind of ordinance, and the county board said, we're passing it anyway, and they just did. They were fairly careful, it looks like. We'll have to analyze a little closer in terms of, did they say all the right things to try to make this legal? These are being fought about in other counties and other parts of the state. And they passed some significant authority now to their health office to do either a specific individual order directed at some of us individually or our individual business, or even a general order that if they deem it reasonable and necessary to prevent and suppress communicable disease, whatever the heck that is, that's pretty darn broad. They can and have an enforcement procedure. They can fine people. There can be a loss of license if they license us to some degree. Now, thanks to the chamber and their efforts, this got toned down a little bit. Originally, in an earlier draft, allowed very specifically for general workplace shutdowns. That came out of the ordinance earlier on. So what passed didn't give that really broad authority. But that doesn't exactly give us tremendous comfort, because now this means that there is authority within the Winnebago County Health Office, subject to challenge and litigation, of course, but to look and start to divide, to put together the kind of things that Dane County did that John just reviewed. John Casper, if I think you're still on here, but is there anything you'd like to add about the Winnebago County situation?
Well, yeah, you summed it up pretty well. I mean, this has been a discussion that's going back, I think, since this past June. And, you know, they did make a couple improvements. I mean, any recommendation or general order that would come out of that public health department would be advisory, or it would be a initial recommendation. It would have to go back to the Winnebago County board, the full board, to approve that. So they would need a 50% or more vote on the county board of those who are present at that time. I mean, you know, that discussion, and it was a 5-hour discussion on Tuesday night, which, you know, I wish I had those hours back in my life, but, you know, it doesn't always work that way. Pretty robust discussion, but it's, you know, they kind of framed it as a set of more of a framework for them to act in case they needed to act. The county executive framed it as a protective face mask opportunity, and in case the Supreme Court, you know, overrules on the current mandate that the governor has, that he would come back shortly. But, you know, as Jim, as you mentioned, very broad in nature in terms of what they can do. I mean, really limited to the imagination of what the public health department can come up with. And I foresee them taking the lead and mimicking what Dane County has done. You know, I mean, it's always seems follow the leader. And Jim, you're absolutely right. I mean, they, you know, as the state has limitations in terms of what they can do, they've been reaching out to, you know, county government to help impose some restrictions that they would rather do themselves. So, you know, stay tuned. We're certainly watching it really closely. You know, I would not be surprised if I see, you know, certain restrictions relating to certain types of businesses, bars, restaurants, limitations in terms of occupancy in businesses. Curfews have been done in other communities across this country. So, you know, stay tuned and hang on, and we're going to keep being vigilant on this.
You mentioned a really important procedural step here, and it isn't that the health department in Winnebago County right now can go out and do this. It does have to come back to the county board. So again, people tuning in, seeing when these meetings occur, note that and by statute, again, they have to pass this first general authority ordinance before the health department can devise a plan and then come back and get voted on. With that vote being 20-16 and with 270 people attending, that next level, and John Iden, you may want to scroll back to that Dane County ordinance and kind of get an idea of what may be coming. This type of thing, if Winnebago puts it together, John Casper, as I want to be clear, it goes back to the county board, then they'd have to approve this, which means that everybody online here plus others can weigh in, up or down, say don't do this or modify it, right?
Exactly. You know, we'll certainly make people aware of that. And you know, a lot of people, I did have a records request that I sent to to Winnebago County, and they responded with thousands of of emails and communications that went to county board members. I mean, I didn't come near reviewing any of those, but just eyeballing the ones that I did. I mean, you know, mostly were in opposition to you know, what the county you know, the county board was looking to do. And you know, the reality of it is businesses have done yeoman's work in terms of not just meeting the CDC standards and protocols for safety for employees and customers. In many cases, they've exceeded those standards, and they've done much more, you know, than is recommended by the CDC. So, you know, it's you know, to kind of look at potentially singling out, you know, businesses, I think is just kind of you know, a mistake on their part. And for the life of me, I don't know why the county board would want to be looking at these and you know, be subjecting themselves to that kind of ridicule, and they will get ridiculed. You know, because they're going to be looking at least virtually eyeballs of friends, relatives, neighbors, and you know, making decisions and that are really going to be affecting people's lives and their livelihoods.
Right, and sometimes it is a really good point, and John and I are going to talk a little bit about some of this part about businesses and liabilities and things, and working with seeing so many of the plans and businesses of putting safety protocols in place. First of all, I don't know anybody that says, I want to be open and we want to be unsafe. I don't know anybody that says we want to be open and expose our employees or hurt our customers. Nobody wants to do that, absolutely not. And the thousands and thousands of dollars that have been invested to have safe workplaces and to protect people is impressive. I got to tell you, when we get to tour a lot of the facilities and things and places that we work with, and it is safer to go to work than it is for people, a lot of people, to stay home, quite frankly. And we have COVID cases that people got it at home, and they may not have if they'd been at work, quite frankly. So with that, maybe John Iden, I would turn back to you then as we pick up on some of these other things. Thanks, John Casper.
Yeah, so turning now to a discussion of some of the guidance, and we're going to talk about masking guidance and guidance on protocols for symptoms and positive cases and exposure. And then we're also going to talk about what is the legal significance of the guidance. So first, talking about the masking recommendations. We've talked about the fact that the extension that is anticipated later this week is kind of in limbo and contingent on the Supreme Court decision. So if the mask mandate extension through January 2021 remains, then really nothing changes from what you're doing right now. It's going to be the same type of order applied in the same way, and your protocol should remain. But if the Supreme Court overrules the authority or determines that the governor doesn't have the authority to extend the mandate, and if your local health officer hasn't passed, or your county hasn't passed some sort of order or mandate that you have to comply with, then with regard to masking, you're in the world of recommendations. And what are we seeing by way of recommendations with regard to masking? Of course, they're all when I say they all of the sources listed are recommending that masks be worn when you're in an enclosed space or you're within 6 feet of someone who's from outside of your household. The executive order passed on November 10th from Governor Evers includes that recommendation. The state and local health departments have made that recommendation, obviously the CDC, and then OSHA. They haven't really changed or updated their position from the spring of this year. They haven't concluded that face coverings, cloth face coverings to catch droplets or secretions for the COVID-19 prevention, they haven't determined that is PPE that must be provided by employers the same way that hearing protection or eye protection. It doesn't fall into that realm. And not providing face coverings or not having a face covering order or policy in place isn't de facto an OSHA violation. They're taking more of a facts and circumstances approach to the issue. However, they do recommend, similar to the other sources cited, that masks be worn when employees are working within close proximity with one another, unless wearing the mask would create some sort of increased risk or danger given the nature of employment. So again, the point of this slide is that if there isn't a state or local mandate and you're in the world of recommendations, these are where the recommendation sources are, the recommendation that masks be worn. And then we're going to, like I said, we're going to talk about kind of what your reaction could be or should be and kind of the legal consequences of deviating from the recommendation. The next is guidance on exposure to COVID-19. So as I said at the top, I think the most difficult scenario for an employer to deal with. Someone tells you they don't feel sick, they're fine, but they've been in close contact. They've been notified by a local health department that they've been in close contact with someone who tested positive. And close contact, for the contact tracing that the local health departments are performing, is defined as direct physical contact, so hugging, kissing, the types of things that family members would typically do. Being within 6 feet of a person for more than 15 minutes, and this is true regardless of whether or not both people are wearing masks the entire time. And then contact with a person's respiratory droplets, so you were in proximity of someone who coughed, sneezed, you shared a drinking glass, again, with someone who tested positive. So the guidance at the state and also at the federal, the CDC level, is to self-quarantine and self-monitor for 14 days. So self-quarantine means to limit all non-essential travel. You're not supposed to go to work. You're supposed to have people run errands for you. You're not supposed to be out and about. If self-quarantine means not at work, but it also means not at the mall, not at the grocery store, not running errands. Self-monitor means monitoring for symptoms consistent with COVID-19. And the 14-day period is the recommendation regardless of whether or not someone tests negative after having close contact. And even that's true, again, based on the recommendation, whether they have 2 negative COVID-19 tests 24 hours apart. So the idea being, and this is we've seen all along the guidance be on the extremely cautious end of the spectrum. And I think that's what frustrates a lot of people, is that the guidance looks at preventing the spread of COVID-19 at all costs without really appreciating or understanding how difficult it is to implement that guidance in a workplace. And especially now that cases are rising, when you talk about a mandatory 14-day self-quarantine for close contact, that's impacting a lot of people, impacting a lot of businesses. I think that's the frustration, that this is an overly cautious approach, but nevertheless, that is what the guidance is. And again, it says 14 days regardless of negative tests. The concern being that a negative test may have been before someone started experiencing the virus, or you can test negative and still get the virus after the negative test. You can transmit the virus even if you don't have symptoms. Even if the person who was a positive test never had symptoms and they weren't experiencing COVID-19 symptoms, they could still transmit the virus. So the fact that transmission can occur absent symptoms, transmission can occur despite a negative test, the cautious approach that state and local health departments have taken is that a mandatory 14-day quarantine, and during that time, you're self-monitoring and self-quarantining. If you start to experience symptoms consistent with COVID-19 or test positive, you then get moved into the next 2 categories we're going to talk about. But if you go through the 14-day period and experience no symptoms, presumably you didn't contract COVID despite your close contact.
Hey, John, just a point that I would make on the guidance, and as we come to one of the things that the isn't talked a lot about is the ability to, what's the impact of a healthcare provider's return to work slip or our doctor's diagnosis of all of this. And as John has said, and as the slide said, this is guidance. This is the caveman version of how we deal with a communicable disease when we don't know what else to do. I hate to put it that way, but the reality of this is, oh my gosh, we got a pandemic, and I'm not saying it isn't serious, and I'm not saying this isn't very, to some degree, deadly for some people. But there are a lot of people it has no impact at all, whether they're positive and certainly if they're not. One of the things in the guidance that's a little controversial, and there are a lot of folks that feel differently about, what about the weight of a physician's slip? Somebody has no symptoms, tests negative, but was in close contact. Go to their doctor. The doctor does the whole analysis of their patient and says, this person can go back to work. What does that mean? That trumps everything. And the guidance says that and the health people that I've talked to about this acknowledge the same thing. Under those facts, if a doctor says can return to work, that does not require a quarantine. Just a heads up on that. So anyway, John, just on that as we work through these different pieces.
Yeah, no, I think that
at all levels too.
I think that's a great point, and that's going to be a big part of our discussion on the significance of guidance, is that there is a distinction between this broad brush that's being painted as a precaution and the fact-specific analysis that you as an employer can do based on what you're seeing, what you're receiving from your employee by way of they're telling you how they're feeling, and then most importantly, what their physician is telling you about their specific circumstances. So the guidance on a positive COVID-19 test is more straightforward. It's a self-quarantine period of 10 days. If the individual doesn't experience any symptoms during that period of time, then they can return after 10 days. If they do have symptoms, then it's a minimum of 10 days and 24 hours have passed since the last symptom. So the cases that we've been handling, typically someone doesn't feel well, they're sent home, they go and test, they have a positive test, they feel bad for 2 or 3 days. And again, this is just very general about the types of cases that we're seeing. I know there are much more severe cases, but in the majority of the cases that we're seeing as employment counsel, feel bad, positive test, 2 or 3 days of severe symptoms, and then they generally begin to improve. So by the end of the 10-day period, they've experienced the symptoms, had the positive test, and have that 24 hours, a minimum of 24 hours of symptom-free. So a lot of times, it is simply the 10-day period. Obviously, more severe reactions, continued symptoms would extend this period of time, but otherwise, the 10-day period is what we're seeing most often with a positive test. Now, the close contact analysis may impact the contact tracing that's done by the local health department may include individuals in the workplace who have been in close contact, and they then are under a self-quarantine protocol as we discussed in the prior slide. But for that positive test, this 10-day period is really the starting point for the benchmark.
There's a comment here, John, just as you're switching slides, that says, so if somebody quarantines and then during that a family member tests positive, does that reset the 14? And it does, as I understand it. So if you're on a quarantine and a new event happens, then we got to march from that new event. Back to your understanding as well?
Yeah, once there's a positive case in the household, then everyone who lives in that household has been in close contact, and the recommendation then is that they also get tested and tested every couple days, I believe is what is being recommended most often, and testing is becoming much more widely available, so that is feasible. Six months ago that wasn't, but now someone can get tested every couple days. And if they go through that 14-day period and never test positive, then they're still in that close contact protocol. If they do contract it from the family member, then they move over to the positive test protocol.
Right, but it's not going to be just one 14-day period. It could be an extended period, and it could be extended multiple times depending on what's the latest contact or latest event and what's the symptoms, etc.
Right. You're in close contact with your daughter who has a short period, but then at the end of the 10-day period or at a later date, your son then shows symptoms and your son gets it. Now you're in close contact with another positive case. You're right. The 14-day clock can continue to roll on as that moves through your household. So symptoms consistent with COVID-19. This is one that is oftentimes part of the guidance and the protocol. Part of dealing with these types of cases does involve going to see the physician and the doctor and getting a negative test. Those pieces of information are really important when trying to determine whether or not the symptoms consistent with COVID-19, which are also symptoms consistent with allergies and common cold and flu and many other things that aren't COVID-19. Going to get a negative test or going to have a physician examination that determines that it's not COVID-19, those pieces of additional information can update and change the analysis. But the protocol and the guidance that we're seeing at the state and the CDC level is similar to the positive test. Self-quarantine for a minimum of 10 days, and you can return after 10 days if you've been symptom-free for 24 hours. And that 10-day period could arguably be shortened if there is a negative test or a physician examination and conclusion that the symptoms are allergies and not COVID-19, for example. So what is there's so many guidance and so many recommendations. What is the significance of the guidance? And obviously guidance is not the rule of law. There are no causes of action or independent causes of action if you are not following the guidance. And the guidance, I mean, there's guidance to redo your entire HVAC system and have your air purifiers throughout your entire building. So the guidance can get extreme, and if someone were to look close enough, there's a piece of the guidance that maybe most employers aren't following. But that, again, doesn't create an independent cause of action. But what we're seeing the plaintiff's bar do is point to the guidance and argue that that is the standard of care that must be followed by employers. And failure to follow the guidance is negligence, or failure to follow the guidance creates an unsafe work environment. I mean, at the OSHA level, there are a number of complaints being filed for failure to abide by the guidance, but we aren't seeing OSHA issue penalties, at least not now. We're not seeing OSHA issue penalties or even really up the enforcement or inspection of whether or not employers are in compliance with their guidance. It is being used as evidence that employers, again, are not meeting the standard of care or not creating a safe work environment. So that evidence, that scientific-based evidence and that scientific-based recommendations, they are out there. It's publicly available. I mean, again, plaintiffs' bar are relying heavily on it. And I think the response to the argument is, and we'll talk about this at a later slide, but the response to this argument is being knowledgeable on the guidance, implementing safety protocols where appropriate, enforcing the safety protocols, and then having a reasoned, fact-based explanation for any deviation from the guidance. And Jim gave a great example. We have this guidance on self-quarantine protocol for close contact. If you have someone who, after being contact traced for close contact, goes and sees a physician, explains the circumstances, the physician evaluates the patient and issues a return to work letter, that is a fact-based analysis that if someone were to challenge you as to why you deviated from the guidance, you have a medical opinion tied to that individual that I would agree with Jim would trump the guidance. But you don't, where we're seeing the real liability, or excuse me, where we're seeing the cases, at least at this point, are with the employers who are just really turning a blind eye to the guidance and not making any meaningful effort to comply. In the Walmart case that was filed early on in the pandemic, the employee reported close contact. I think it was put back to work 2 days later, had a very negative reaction to the COVID-19, to contracting COVID-19, and the lawsuit alleged that they were on notice of the illness and then put him back to work immediately, not only endangering himself but all of his other coworkers. There's similar cases in the meatpacking facilities earlier on in the pandemic where the virus was widespread, but there was really no steps being taken to quarantine or isolate employees. There was another case I read about yesterday where the employer circulated a memo saying masks don't work and actually openly advocating against masks, which is obviously inconsistent with the guidance. And those types of fact patterns are where you're likely to see the litigation. And all of this is still pending. I mean, frankly, we haven't seen any of the cases that have alleged as a premise failure to follow the guidance equates to negligence and creates liability. Those cases have not been adjudicated. We haven't seen how courts, at least yet, how they are going to respond to those arguments. But again, what we're seeing by way of litigation are those egregious cases where employers are not making a meaningful effort to comply with the guidance. So Jim, anything else on the significance of guidance and how employers should read and react to it?
Let me just quickly mention about the positive test that you get. An employee calls and tells you that they weren't feeling well, they went in and they got tested and they're positive. And just for a second, based on this guidance now that we have and what that all means. First of all, it doesn't mean that we, and under the guidance and procedures, have any responsibility. I'm not saying you can't, but call the local health department. You don't have a reporting obligation as an employer. In the earlier slide, John had pointed out to say you can expect a call because we're going to be doing some tracing. What happens is the medical provider is required, has a reporting requirement to the local health agency. The local health agency talks to the person who tested positive and they get an initial read on the tracing aspect of things. Who else do they got to follow up with? And then they have people employed as the tracers that work on the aspects of that, which may mean the employee says, yeah, I was at work and I was in contact with certain folks. They'll call you and then you'll have some responsibility. And you know already that you don't name the person who tested positive because it's a health issue. It's a confidential disclosure issue. It's a little odd to say, I can't say that it's the person in the corner office, but anybody that came in contact with someone in the corner office, we're going to have to talk to you and we have to have you quarantine or aspects of that. But we will, and I know, John, you're going to talk a little bit about this too, but then we're going to contact people and see who else we may have to quarantine. And we're going to clean, bullet point. Clearly, you're going to clean the area that the person was in and sanitize and take care of all other safety precautions that would go with that. Consider in your bullet points whether you want to send out a memo to the employment group to say we had a positive test. We've dealt with it. We've communicated with the people that have been in close contact. And are you required? No. Is it a nice touch from a personnel standpoint that your staff knows that you take this seriously, that you are on it, that you're concerned about their health? Yeah, it's a nice thing to do in that regard. Not required, but a good thing to do. Those are some bullet. John, I know you got some other thoughts on that, but I just wanted to stop just for a second to say, okay, if we get that, what are the bullet points we should think about? Those are the initial bullet points you want to think about as it fits into the guidance and your requirements or not your requirements.
Yeah, that's a good transition to some of these frequently asked questions, and you did a nice summary of the response to a positive test. And I think that the employers that we're working with rely on the local health department to conclude who was in close contact. But I think as far from a managing your own personnel standpoint, if you know that an individual who's tested positive routinely works with an individual, then your contact tracing isn't necessarily just cold calling or pulling people into the office. You have an informed ability to contact trace because you know the dynamics of the office and who comes in contact with one another. So it isn't contact tracing in the same way the local health department is, but you may communicate, as Jim said, that there's been a positive case, and you're also doing your sanitation protocols in response to a positive test, the areas where that employee works and routinely navigates. We talked about the risk of bringing an employee back earlier than the guidance recommends. I think you can significantly reduce, if not eliminate, the risk if you are making a decision based on medical opinions from that individual's physician. Turning a complete blind eye to the guidance and simply asking someone, are you feeling okay today to come back? And it's been 3 days since the positive test and they come back, that's a different fact scenario. But these are fact specific. The guidance is not the rule of law. And I think if the facts support if the facts show that you've evaluated the potential risks for this individual in the workforce and you feel comfortable based on the fact that you've received, deviation from the guidance, I don't think is an automatic trigger for liability. A question I get a lot is, how can I verify whether an employee has been in close contact with someone? They have employees who repeatedly report close contact. They know that close contact will get them out of work and they don't like working, so they don't care if it's FFCRA covered or not. Deer hunting's coming up and I could use 14 days, so I've been in close contact with someone. Unfortunately, it's really hard to verify. I mean, obviously the FFCRA, the Families First Coronavirus Response Act, the emergency paid sick leave does have a documentation component. They need to be under a self-quarantine order from a local health department. So it would be appropriate to ask for documentation that they've been contacted through the local health department and that they are instructed to self-quarantine. But if someone simply says to you, I've been in close contact, or I'm experiencing symptoms consistent with COVID-19, an example that takes it out of the contact tracing and the self-quarantine order. It's difficult to verify, but I do think that another FAQ here regarding discipline for COVID-related absences, these are not automatically excused. And yes, employees are entitled to job-protected leave under the Families First Coronavirus Response Act, but once that has been exhausted, COVID-related absences aren't a blank check not to come to work. So I think there are tools that you could utilize, asking for medical opinions or having them go to their doctor to explain their symptoms and conclude or confirm whether it's COVID-19 related. But when you're dealing with a third party who's not your employee and their health condition, whether they're experiencing symptoms or they've tested positive, it's really hard to ask for, and it's arguably prohibited to ask for medical documentation from that third party to verify that this third party has COVID-19. I think that the employer response oftentimes focuses on educating employees that consequences have actions, that our attendance policy is still in place and enforceable, and that COVID-related absences are not excused absences, and dealing with it from an education and a discipline component proactively, rather than, I guess it's a hybrid model, but rather focusing on that in addition to trying to verify. Jim, any additional comments on how to verify a suspected abuse of these protocols?
Right, and you're absolutely right. I totally agree with you that we can't ask for a third-party person's medical information, and I know some people say, well, if I'm sending people to the doctor, that's going to raise our costs, that's going to raise their costs, that's going to hit deductibles. But we are dealing with a pandemic and a pretty serious illness here that has a pretty serious impact on our workplaces. So you got to step away from the employee's word from it sometimes. You can take that if you're pretty comfortable with it, but if we're getting the abuse scenarios, we ask the person you can make them go to the doctor. You can make them be tested. I'm talking about our folks, our employees, as a requirement. And then we work off of medical information. A doctor can say, I met my patient and so-and-so, they were in close contact. The person that's making it up is a little less hesitant to do that. If we make them go do something about it, they got to lie to the doctor, or maybe tell a falsehood to the doctor, and then the doctor's got to write an opinion based on that. That we've seen a drop in those kind of scenarios from those folks when they got to actively go do something. They can't get away with just saying, oh, by the way, my third cousin once removed stopped over who met with somebody else who did a bear hug, which is a sexual harassment case for another program. But in any event, it's not a way just to get out of work without medical verification or sending something to the doctor.
So can I require employees to work from home during self-quarantine? The answer is, I mean, if they have the FFCRA job protected leave, then they're entitled to that leave, and you can negotiate or work with them on a flexible schedule where they're not taking this as a block, that they are taking it on an intermittent basis given what they have going on at home. But the short answer is yes, that employees who can work from home and they've reported to you a close contact so they can't be in the workplace, you absolutely can require that they perform work from home. And I think that's what a lot of employers are doing to alleviate the stress that these self-quarantine protocols put on them, is making efforts to keep these employees productive when not in the workplace. Jim talked about communicating to other employees when someone tests positive. The FFCRA leave is a job protected leave that kind of trumps the analysis of the quarantine protocols that someone has available and they're eligible for the FFCRA leave. You want to evaluate that eligibility first and make sure that any time away from work that does qualify is being counted, so employees are not getting more leave than they are entitled to. And I talked about the fact that COVID-related absences are not automatically excused or immune from discipline. So and Jim, feel free to interrupt if you're seeing questions that we should address before the end here. But in the last couple minutes, just a brief summary of the COVID-related litigation that we're seeing here early. I mean, the conduct that is going to lead to litigation is just happening now. I mean, I think 2021 is going to be a year where the plaintiff's bar becomes a little more proactive. We're going to see some early decision. We're going to see some decisions on these early cases regarding negligence and wrongful death that I talked about. We're starting to already see refusal to accommodate cases under the ADA, arguments that employees are entitled to masking exemptions, or they should be entitled to remote work because they're in a high-risk category for COVID-19. They want enhanced or alternative safety precautions because they're in a high-risk category for COVID-19. The takeaway on the ADA is that it remains a fact-specific analysis tied to the nature of the disability and the requested accommodation. And all of that, as an employer, you have the ability to investigate and verify through medical documentation. So this is especially an area where you're not taking employees at their word. You're not just agreeing to whatever accommodation the employee feels is appropriate. The ADA is very clear that the employer is obligated to provide a reasonable accommodation, but not the accommodation that the employee dictates. So if you're in that ADA realm, where an employee is citing a disability for a change in their work conditions or a change in the safety protocols you have in place, that's an opportunity to, again, engage in this interactive process, which has the mechanisms built in to verify and allow you as the employer to have some say into what the reasonable accommodation would be. Not a lot in my experience. I don't know if you've seen any of these cases, but I know nationally there has been some cases regarding denial of FFCRA leave. And then the last category is the wage and hour related to remote work and making sure that you have a mechanism in place to capture all compensable work when employees are not working on your premises. And we've talked in earlier presentations about these remote work agreements that clearly outline the parameters of the physician, the hours that are going to be worked, the timekeeping mechanisms, the fact that you are still working for the employer on a work-provided device. So even though you're in your home, this is not your personal computer, this is not your personal time. When you're on the clock, it's like you're sitting in your office. So those types of agreements or policies are really helpful to address some of the potential wage and hour cases that come with the increase in remote work. We talked about the measures to prevent litigation. And then finally, just wrapping up, looking ahead to 2021, the FFCRA is set to expire at the end of the year. I expect there will be a discussion and probably some sort of job protected leave and potentially another paid leave component next year, given the fact that the pandemic will obviously be ongoing. The discussion of vaccines is going to continue to increase, and we're going to see in 2021 at some point a vaccine implementation protocol at a state and or federal level. And I think that protocol, the speculation early on now is that it's going to be a protocol that prioritizes certain industries, the healthcare industry, then prioritizes the at-risk groups, and then eventually trickles down to the masses. And how that is rolled out, whether it's a mandate or a recommendation, how the vaccine impacts your ability to move about society. If you have the vaccine, are you subject to these county orders or not? It's going to be very interesting to see if that's not handled at a federal level, how it's mandated and handled at a state level. We talked about the state versus federal orders on masking, distancing, travel, occupancy limits. I think Wisconsin has had some case law that suggests the state doesn't have the authority. I would be surprised if we saw anything at the federal level, but at least in the short term, we're likely to see more of that, as we've discussed, at the local level. Increased testing. I think it's going to be much easier as an employer to access and implement protocol in response to tests and symptoms and close contact as testing becomes even more widely available. And I think there's a lot of effort being put into some ability to home diagnose and home testing ability. And while every individual is unlikely to have a test in their home, I think it's possible that every employer would have access to a testing mechanism that they could administer at their site at some point in 2021. And then again, just the evolution and the continuation of the litigation that is being filed now will likely be decided in 2021, and then how how courts have responded to those cases will impact what type of litigation we see going forward.
And with that, John, we got to wrap up and respect, because we've got, I know with time, very quickly, just on some questions on the capacity aspect, dealing with these local ordinances. You really got to look to the local ordinances. There is some language about some exclusions and modifications to the capacity within it. I can't tell you off the top of my head what Dane County is on capacity, like a manufacturing exemption or some of those kind of things that's going to allow more in, but there is some language in regards to those. I'm not aware of workers' comp cases is another question we have. I do know that within the governor's anticipated bill that's coming, he's looking to do some presumptions of coverage for frontline worker type persons, but that's not law yet. And some of the counties, as it says here in a question, are not doing contact tracing, which is interesting. And true, but it still gives us some responsibility to take a look at it, as John said, because the guidance is out there to say, here's some things you ought to do, and here's some people ought to quarantine. So from a liability standpoint, we should look at that as businesses and things and follow up on that if we're not getting the calls from the local health. So stay tuned. Just when we think we're through it, it keeps changing. Within the last couple of days it did. As John said, we're updating the program this morning, and with that I'll turn it back to John Casper.
Well, thanks Jim and John. Great program as always. As I mentioned before, this has been recorded. We will post it on our website, so if you want to view it again, please go to our website under archived video conferences. So with that, we are Looking at every Thursday, every Thursday. Yeah, every Thursday, Jim, we're going to do this. No, every third Thursday of the month, 8 o'clock. We schedule these things out through the rest of all time, I'm guessing here. So we don't have, our next one is on the 17th of December, working on a topic. Jim mentioned before, if anybody has any suggestions, things you want to do, please forward those on to Jim or John. And they'll evaluate those and put a program around it. So with that, again, thanks, John, Jim, with Von Briesen and Roper for joining us. And thank you all for tuning in today. And we will see you on the 17th. Thanks a lot.
Thank you.